the young mothers, some of them do not know what to do. Then we educate them, and then we make referrals to Sonaragana so that they get their best information and the type of, they make the good choices of using the contraceptions. And we as Creamo, we really encourage that when you're using contraceptions, that is to birth control in simple terms, or planning your family, you include your partner so that you don't do it single-handedly. And as Creamo, we really deal with youths, both in school and out of school. So in school, we really encourage the young youths to abstain. No need to have sex at that age, because they still have a lot to do, and therefore by abstaining they will be preventing teenage pregnancy and also preventing STIs. And to the young mothers who are outside of school and young fathers, we really encourage the use of contraceptives. And once we tell them the types, then we consider how do they choose these contraceptives that suit themselves. We are doing our outreaches at the community level. There are challenges and gaps that we meet. So these challenges, as you'll find that they have the information, but choosing the right one, making the right choice of the contraception to use is difficult. Then you'll find that these young mothers, most of them, they go for the injection type, the injectable type, that their partners won't know that they are planning. So we advise them to engage their partners. So the challenge there, when you ask them why they choose to be secretive with it, you'll find that some young fathers don't allow their wives to use these contraceptives. And then you'll find that one will lead these mothers to go for injection that will not be known, will not be seen. So that is a challenge. So by overcoming this challenge, we really encourage them to engage their partners, so that if any problem arises, then they will both be able to attend the facility and be guided accordingly. Religious beliefs is also there, and we really engage the pastors. When we are going to meet the community, if we are going to talk about the contraceptions, then we include the pastors. So we give our part, and then we also give the pastors their part. So they also try to convince and use real issues to make these young mothers see the need of planning their families.
You see, contraception is an essential service every family and every individual must get, because not everybody is ready for giving birth, and especially the fertility rate. Your government is discussing much of reducing from 18 to 16. Why? Because the facility rate is very high, very low now. You can find a 13-year-old, 15 years old is already fertile and can give birth, but this person cannot make a decision. There are those who are not ready to give birth for reasons known by themselves, but they cannot stop doing sex. Sex people will do, even at the tender age, and you cannot control where they are doing it. You will only see the outcome. So our activities are to ensure that partners that are supporting family planning understand the cohorts that they are supporting, young people between 14 to 24. So we are targeting also the most at-risk population for both infection and unwanted pregnancy. So, and this population falls under that age bracket. Again, we are also targeting those who are in school, and because when they are in school, there is a bit of control, and it is easy now to reach them and advise them on what best method they can use. But again, the challenge remains that once you discuss issues of contraception in the age-going girls or boys, then it's like you have given them ticket to do sex, which also jeopardize the other aspect where we are dealing with a comprehensive sexual and reproductive health among this age bracket.